Hello viewers, this is Dr. Rajiv. Welcome to your education channel YouTube Surgery and Orthopedic Education. Please consider subscribing it as well as share it to your near and dears to help them in their preparation of MBBS course as well as other postgraduate and job entrance examinations. Also, please don't forget to press the bell icon below so that you never miss an update from us. In this lesson, we shall cover 10 MCQs on an important topic from competitive exams point of view, the vermiform appendix. Each MCQ will be followed by a description. You may prepare a note of important points for future reference. A lot of material would be delivered in this talk, so hang on in till the end. The correct answer in question number 1 is option A. Yersinia enterocolitica infection or yersiniosis can sometimes mimic appendicitis, a condition known as pseudoappendicitis. This is because the Yersinia infection causes inflammation of the terminal ileum, appendix and cecum with mesenteric lymphadenitis. Serum antibody titers are diagnostic and drug of choice is tetracycline. Enteropathogenic Escherichia coli (EPSC) is a type of E. coli that causes diarrhea in infants and young children, not appendicitis-like illness. Enterobius vermicularis or pinworm causes intense itching around the anus, especially at night. Trichomonas hominis is a non-pathogenic flagellated protozoan that inhabits the large intestine. It typically does not cause symptoms. However, its presence in the stool samples indicates fecal contamination of a food or water source and potential exposure to other pathogens. The correct answer in question number 2 is option D. The Lange incision is a transverse muscle splitting incision made at McBurney's point for open appendectomy. It follows Langer's lines aimed at reducing scarring and improving cosmetic result. Kocher's incision is a right subcostal muscle cutting incision used for open cholecystectomy. The Rutherford-Morrison incision is an extension of the gridiron muscle cutting incision. It allows better exposure of the abdominal cavity compared to the standard gridiron incision. A Pfannenstein incision is also a muscle cutting transverse incision made just above the pubic bone. It is used for performing caesarean sections and hysterectomies. It is also known as a bikini line incision because the scar remains hidden by the clothing. The correct option in question number 3 is option D. The appendicular artery is a branch of the lower division of the ileocolic artery. The vermiform appendix is supplied by the appendicular artery. It is a branch of the lower division of the ileocolic artery. It passes behind the terminal ileum and enters the mesoappendix. Sometimes an accessory appendicular artery may be present. The accessory appendicular artery is a branch of posterior cecal artery which arises from ileocolic artery. The appendicular artery is an end artery. Its thrombosis results in gangrenous appendicitis. The ileocolic artery arises from the right side of the superior mesenteric artery. The ileocolic artery supplies blood to the terminal ileum, ileocecal valve, cecum, vermiform appendix, and the proximal ascending colon. The correct answer in question number 4 is option B. Fever in uncomplicated acute appendicitis typically ranges between 99 degree Fahrenheit and 100.5 degree Fahrenheit, which is a low-grade fever. If the appendix bursts, the resulting peritoneal infection can cause the fever to rise above 101 degree Fahrenheit. A high-grade fever is typically defined as an oral temperature of 102.4 degree Fahrenheit to 105.8 degree Fahrenheit in adults. The correct answer in question number 5 is option C. In perforated peptic ulcer, the duodenal contents pass along the paracolic gutter to the right iliac fossa and give rise to appendicitis-like symptoms. Renal conditions like right-sided uretary colic and acute pyelonephritis may cause diagnostic dilemma. Nature and radiation of pain differs from that of appendicitis in these conditions. Urinalysis and ultrasound are diagnostic. In Crohn's disease, symptoms may mimic appendicitis. In contrast to appendicitis, Crohn's disease symptoms develop more gradually and include chronic or intermittent abdominal pain, diarrhea, weight loss, and fatigue. In cholecystitis, the pain occurs in the region of the right hypochondrium. Its presentation is different from acute appendicitis, in which the pain shifts from around umbilicus to the right iliac fossa. The correct answer in question number 6 is option C. Pre-operative investigations that help in diagnosing acute appendicitis are CBC, urine test, pregnancy test, urea and electrolyte measurements, radiograph of the abdomen, ultrasound of the abdomen, and contrast-enhanced CT of the abdomen and pelvis. A pregnancy test is crucial in cases of suspected acute appendicitis in females of childbearing age to exclude pregnancy-related conditions that mimic appendicitis, such as an ectopic pregnancy. Colonoscopy is generally not used to diagnose appendicitis. On the other hand, there is some evidence suggesting that colonoscopy can, in rare cases, might predispose to appendicitis. The correct answer in question number 7 is option A. In doubtful cases of appendicitis, a lower midline incision is a better choice than a right lower paramedian incision. A paramedian incision is difficult to extend, difficult to close, and provides inadequate access to the pelvis and peritoneal cavity if need arises. Rutherford-Morrison's incision is useful when the appendix is paracecal or retrocecal and fixed. Lange incision is a muscle splitting incision. It also provides limited access to the peritoneal cavity. The correct answer in question number 8 is option C. Crohn's disease is a relative contraindication to appendectomy. Appendectomy in this group of patients is associated with a higher risk of complications and a worse prognosis. Crohn's disease patients who undergo appendectomy may experience increased post-operative recurrence and complications, particularly if the disease is active or involves the cecum or the appendix. This is because appendectomy causes intestinal dysbacteriosis or an imbalance in the gut's microbiome that might cause flare-ups of the existing inflammatory disease. Other options have no reason to preclude appendectomy. Presence of an appendix mass or phlegmon is a complication of acute appendicitis. Here, the inflamed appendix is walled off by surrounding tissues like omentum and a small gut. Surgery in this condition becomes difficult, and it may be impossible to find the appendix, and occasionally a fecal fistula may form. If an appendix mass is present and the patient is hemodynamically stable, the standard treatment is the conservative Ochsner-Sherren regime. This regimen aims to avoid immediate surgery and, instead, manage the condition with careful monitoring and supportive care. The rationale of this strategy is that the inflammatory process is already localized and surgery may allow a spreading of infection to other areas of the peritoneal cavity. The correct answer in question number 10 is option B. The Alvarado scoring system is used to assess the likelihood of acute appendicitis. It combines symptoms, signs, and laboratory findings to create a score that assists in diagnosis and management. It is also known by the mnemonic MANTRALS. The score has 6 clinical items, 3 signs, 3 symptoms, and 2 laboratory measurements, leukocytosis and left shift, each given a score with a total of 10 points. A score of 7 or more is strongly suggestive of acute appendicitis. The Alvarado score is a useful tool in settings where advanced imaging may not be readily available. However, it should be interpreted in conjunction with clinical judgment and other diagnostic tools.